Today's topic is about neuroplasticity. I am Dr. Anu, a neurophysiotherapist with over 18 years of clinical experience, and I'm going to talk about neuroplasticity and its clinical applications today. Now, to begin with it, you must have heard this word a lot of times, and there has been a lot of interest in the research recently regarding this. What is neuroplasticity? It is a brain's ability to rewire itself, as the word itself states. Now, whenever we are encountered with any injury, it could be in clinical scenario, any stroke, brain injury, post-brain surgery conditions, where there is an insult to the brain. Now, post that, how the brain is trying to recover from that condition, how the brain is trying to rewire, reset itself from that condition, this healing ability of the brain is termed as neuroplasticity. Now, as clinicians, we want to make sure that our patients are recovering fastest. So there are certain principles of neuroplasticity which I'm going to share today and share insights upon how using these principles can enhance the patient clinical recovery and outcomes in functional activities. See, we all understand that a patient who has undergone the loss of a particular function because of impact of a certain area in brain may present with hemiplegia, hemispatial neglect, or weakness of any particular side. Now, while training the patient, our aim is to work on the peripheral part and connecting the peripheral function through the CNS circuits. Now, we do understand that whatever activities we are doing, they are representing an area in the brain. That is called brain mapping. Every part of the body has a representation in the brain, and every task we as humans learn, or any person has been doing some task previously before the injury, they have certain dedicated areas in the brain, they have dedicated maps and neural circuits in the brain which are representing that functional activity. Now, my approach has to be based upon the patient's functional history, not as a random approach or like one approach fits all kind of thing. Why? Because an individual's functional history would indicate the right step of activities that you have to focus on for better recovery in that individual. Let me make it simple for you. For example, there is a patient who had been a teacher, and the main activity he or she was engaged during the life before that episode of stroke or brain injury was every day to, of course, do the common activities of daily routine in the morning, like brushing teeth, bathing, dressing up, which I'm sure is one major part of our trainings. But the other part would be specific to that teacher, which involves tasks which were part of her routine and not the routine of maybe another individual who is a IT professional or who is a housewife or a plumber or a doctor, anybody else. So how you are breaking the professional history, or even if the person is not professional, the work history of that individual into the rehab protocol that you're designing for the person. Okay. Now, as a teacher, this patient had been writing on the blackboard every day. This teacher was standing for long hours. She was bending down and checking the notebooks, right? So there were particular actions she was used to do, and her brain had the history or the old circuits, neural circuits of these particular functional activities. Now, while reviving the patient, while working on the functional recovery of the patient, as a physiotherapist, knowing the principles of neuroplasticity, my approach would be to break it down into common practices and specific practices. Now, common practices would be based upon, of course, what we need to do and working on all the related protocol for it. But I will also include a task-specific training for this individual. I'll speak with her, figure out what those activities were for her individually. Was she writing too much on the blackboard, or was she was too much into speaking? Was she too much into checking the notebooks? Was she too much into setting the paper? What exactly was the thing that was major part of her routine? Was she a kindergarten teacher, or was she a teacher of higher classes? Based on this, I will have enough information about how her overall protocol was earlier, right? And this helps me to break down the functional exercises that I'm going to design for her. Why? Because we are trying to tap into the brain's existing circuits, and we want to rewire those circuits into the unaffected areas using neuroplasticity principles of when the unaffected part takes over the affected part. When we repeat the signals and we make it work by use it or lose it, or use it and make the most of it, right? So using these principles, now if I'm breaking down, maybe earlier I was making the patient do pick and like taking small objects and picking it, placing it in the other container. But now I know that she had been writing on the blackboard. My activity for her would be to keep the elbow in this position and breaking down the writing on the board task into smaller steps for her. What am I achieving with it? I'm trying to recreate the neural circuits from periphery to center of the brain and giving her enough environmental variations, giving her enough sensory variations to ensure that those forgotten synapses can be rewired. Ensuring that that coding which was there in the neural circuits earlier was easily replicated, can be reinforced, and the patient is able to learn and adapt to that previously existing function faster, rather than me teaching her entirely different thing. She had not practiced picking the pebbles from one bowl to the other. She has not practiced pulling the TheraBand earlier, but she has practiced these writing on the blackboard thing, which technically involves movement at the shoulder, movement at the elbow, and fine movements at the wrist and the distal PIP joints. So now you understand that using specific activities for one particular individual, by talking to that individual and identifying what was the particular specific function they had in their work histories. It could be a housewife, it could be a doctor, it could be an electrician. You need to figure out what was the hand body movement alignment patterns they have in their brain already. So working on that specifically by using that work history knowledge into your rehab protocol will make it far more easier for the person to recover. It will give them that sense of regaining that previous lost function, trying to achieve that function, and brain will show the plasticity faster. And then once you work on this principle, then you can work on the metaplasticity, which is plasticity of plasticity. A plasticity of plasticity means the conditions which will ensure that the neuroplasticity is more active or faster in an individual. What can we do for that? Nutrition plays a role. Environmental factors play a role. Motivation is important. Positivity is important. So by ensuring that you create a family positive environment around the caregivers, giving them daily motivational tasks by giving them short-term goals and working towards them and making them rehearse in their brains that yes, I achieved doing 5 repetitions of this task yesterday. Reinforcing that belief in their own abilities will create the plasticity of plasticity situation for them in the brain. Increasing the angiogenesis, neurogenesis, synaptogenesis, working on the structural plasticity. So we start from functional plasticity of rewiring and trying to sending the signals from previous existing maps or the neuronal circuits, and gradually by repeating the task and working on the environmental factors or the plasticity of plasticity factors to create and finally enter into the structural plasticity stage. I hope today's brief introduction about neuroplasticity principles was useful to you. If you're interested in learning more such concepts and ideas, I'm conducting a detailed workshop on neuroplasticity and its clinical applications in stroke and brain injuries coming weekend. If you are interested, please drop your messages in the comments. I'll be sharing details soon. Thanks for watching.